Hello everyone. Welcome back to Learn with Professor Janula, your space for smart, simple learning in nursing and healthcare management. Today's topic is collective bargaining in nursing management. If you are new to this channel, don't forget to like, share, and subscribe for more nursing insights. Nurses, just like other employees, sometimes face problems at work, such as heavy workloads, low salaries, limited benefits, or poor working conditions. To deal with these issues, nurses come together as a group through their unions or professional associations. They talk and negotiate with hospital management or employers to get fair treatment, better pay, safer workplaces, and improved benefits. This process of group discussion and negotiation between nurses and management is called collective bargaining. It helps make sure that the voice of nurses is heard and their rights are protected, while maintaining good relationships with their employers. Let's see about collective bargaining. Collective bargaining is a process of negotiation between employers and employees, usually represented by their unions or associations. Through this process, both sides sit together to decide on important things like wages, working hours, benefits, and other job conditions. It is not about fighting or arguing. Instead, it's about mutual discussion, compromise, and agreement. The main goal of collective bargaining is to create a fair and balanced relationship between management and employees, where both can work together for better results and a positive workplace. Now let's look at the main objectives of collective bargaining in nursing. First, it aims to secure fair wages and benefits for nurses. For example, through collective bargaining, nurses can negotiate for better salaries, overtime pay, and health insurance benefits that match the nature of their work. Second, it helps to ensure safe staffing levels and good working conditions. This means making sure there are enough nurses on each shift, proper equipment, and a safe environment for both staff and patients. Third, collective bargaining works to protect nurses from unfair dismissal or exploitation. It sets clear policies so that no nurse is terminated without a valid reason or treated unfairly by management. Fourth, it helps establish systems for resolving grievances and disputes. If nurses face any workplace issues, there are proper channels to raise concerns and find fair solutions through discussion. Fifth, it aims to promote job security and professional dignity. Nurses feel more confident and respected when their jobs are stable and their voices are valued in decision-making. And finally, collective bargaining helps foster healthy labor management relationships. It encourages teamwork, open communication, and mutual respect between nurses and administrators, leading to better patient care and a positive work culture. Let's now understand the principles of collective bargaining in nursing. First, we have voluntary participation. This means both the employer and the employee representatives agree to come together and negotiate willingly. For example, the Nursing Association and hospital management decide to meet to discuss salary revisions, not because they are forced to, but because both want a fair solution. Second, good faith negotiation. Both sides must talk in an honest, open, and constructive way. For instance, when nurses share their workload problems, management should listen sincerely and try to find a practical solution instead of ignoring their concerns. Third, equality of status. Both parties should have equal rights and respect at the discussion table. For example, during a meeting, nurses' representatives should be treated as equal partners, not as subordinates, because both sides are working toward a common goal: better patient care and fair work conditions. Fourth, the principle of give and take. In collective bargaining, compromise is essential. For example, nurses might agree to flexible duty hours if management increases their benefits or provides extra staff support. Both sides adjust to reach a balanced agreement. Finally, binding agreement. Once a decision or agreement is made, it must be respected and followed by everyone. For instance, if both parties agree on new pay rates, the hospital must implement them, and the nurses must honor the agreed working terms. These principles help make collective bargaining a fair, respectful, and effective process, ensuring that both nurses and employers work together for mutual benefit. Now let's look at the process of collective bargaining in nursing. To make it easy to remember, here's a simple mnemonic. Please never break a real important rule. Each word stands for a step in the process. First, P for preparation. This is the planning stage. Both sides collect data, identify issues, and set clear objectives. For example, the nurses' union gathers information about workload, salaries, and staffing ratios before starting the discussion. Second, N for negotiation. Here, representatives from both sides meet, nurses' union leaders and hospital management, to present their demands and concerns. For instance, the nurses may request reduced night shifts or increased overtime pay. Third, B for bargaining. This is the real discussion phase, where offers, counteroffers, and compromises are made. For example, the hospital might offer a smaller salary increase, but agree to add more staff to reduce workload. Fourth, A for agreement. After discussion, both sides reach a common understanding and finalize the terms. For example, they might agree on a 10% salary raise and improved duty rotation. Fifth, R for ratification. The agreement is then formally approved by both the union members and the management. For instance, the nurses vote to accept the new contract, and the hospital board signs it officially. Sixth, I for implementation. This is where the agreed terms are put into action in the workplace. For example, salary revisions are made and new shift schedules are introduced. Finally, R for review. The last step is periodic evaluation to make sure both sides are following the agreement. For instance, after 6 months, they may review whether staffing levels and working conditions have actually improved. So, remember the process easily with the mnemonic. Please never break a real important rule. Preparation, negotiation, bargaining, agreement, ratification, implementation, and review. This process ensures that nurses' voices are heard, employers' needs are balanced, and both work together for a healthy, productive environment. Now let us see about the types of collective bargaining. 1. Distributive bargaining, conjunctive bargaining. 2. Integrative bargaining, cooperative bargaining. 3. Productivity bargaining. 4. Composite bargaining. 5. Concession bargaining. I will explain each type in the coming slides. The first type is distributive bargaining or conjunctive bargaining. This type of collective bargaining is based on a win-lose situation, where the gain of one party results in the loss of the other. It usually happens when both sides are trying to divide a limited resource, such as salary or benefits. For example, in a nursing context, the nurses' union may demand a 20% salary increase, while the hospital management offers only 10%. After several rounds of discussion, both sides may finally agree on 15%, which represents a compromise where each side gives up part of their demand to reach a common agreement. In simple terms, distributive bargaining is like sharing one pie. If one side takes a larger piece, the other side gets a smaller one, /P. The second type is integrative bargaining or cooperative bargaining. This type of collective bargaining follows a win-win approach, where both management and employees work together to find solutions that benefit everyone. Instead of competing for a larger share, both sides focus on solving problems and improving conditions through cooperation and understanding. For example, in a nursing context, The hospital management and nursing representatives might jointly design a flexible shift schedule that allows nurses to get adequate rest while still ensuring hospital efficiency and patient care. As a result, both parties gain something positive. Nurses enjoy better work-life balance, and management maintains smooth operations. The third type is productivity bargaining. This type of collective bargaining focuses on improving productivity through mutual cooperation between employees and management. In this approach, employees agree to enhance their performance, efficiency, or output, and in return, management offers better wages, bonuses, or other benefits. For example, in a nursing context, nurses may agree to implement a new patient monitoring system that helps improve the quality and efficiency of patient care. In exchange, hospital management may provide performance-based incentives or additional training opportunities for the staff. The outcome is that higher productivity leads to benefits for both employees and employers. Nurses gain recognition and rewards, while the hospital achieves better patient outcomes and operational efficiency. Composite bargaining. This type of collective bargaining covers multiple issues beyond just wages, including working conditions, job security, health benefits, and career development opportunities. It takes a holistic approach to improve both the professional and personal well-being of employees. For example, in a nursing context, negotiations may include discussions on salary adjustments, safe staffing ratios, workplace safety policies, and continuing education programs for nurses to enhance their skills. The outcome of composite bargaining is improved staff morale, professional growth, and a more supportive work environment, which ultimately benefits both nurses and the healthcare organization. Finally, concession bargaining. This type of collective bargaining takes place during times of financial difficulty when the organization is struggling to stay stable. In this approach, employees agree to give up or reduce certain benefits temporarily to help the organization recover from the crisis. For example, in a nursing context, nurses may agree to freeze wage increments or reduce overtime claims during a hospital's economic downturn, in return for a guarantee of job security and continued employment. The outcome of concession bargaining is that it helps maintain organizational stability and prevents layoffs, ensuring that both the hospital and its employees can recover and move forward together once conditions improve. Now let us discuss about the types of issues in nursing collective bargaining. Collective bargaining in nursing covers a wide range of issues that directly affect nurses' professional lives and overall well-being. Economic issues. These include matters related to salaries, overtime pay, allowances, and retirement benefits. For example, nurses may negotiate for a fair pay scale or additional compensation for night shifts. Workplace conditions. This area focuses on staffing ratios, workload distribution, and safety measures. For instance, nurses may demand a safe nurse-to-patient ratio or better protective equipment to ensure both staff and patient safety. Job security. These issues deal with tenure, promotion, transfers, and termination policies. Nurses often seek clear and fair procedures to avoid unfair dismissal or favoritism in promotions. Fringe benefits. These include health insurance, maternity leave, paid vacation days, and pension plans. Nurses may bargain for extended maternity leave or improved health coverage for themselves and their families. Professional concerns. This category addresses continuing education, training opportunities, and professional recognition. For example, nurses may request hospital-sponsored workshops, scholarships for higher studies, or awards for outstanding service. Overall, addressing these issues through collective bargaining helps enhance nurses' job satisfaction, professional growth, and the quality of patient care. Advantages of collective bargaining. Collective bargaining offers several important benefits for nurses, healthcare organizations, and the overall work environment. It helps improve nurses' working conditions and morale by ensuring fair treatment, better facilities, and reasonable workloads. It also provides a structured method for handling disputes, allowing issues to be discussed and resolved peacefully, rather than through sudden protests or resignations. Collective bargaining strengthens nurses' negotiating power because, as a group, they can voice their needs more effectively than as individuals. Additionally, it reduces the chances of strikes and conflicts by encouraging open dialogue and compromise between management and staff. Ultimately, it promotes industrial peace and cooperation, leading to a more harmonious workplace where both nurses and administrators work together toward common goals, such as quality patient care and organizational growth. Limitations or challenges of collective bargaining. While collective bargaining has many benefits, it also comes with certain challenges. Sometimes, if negotiations fail or reach a deadlock, it may lead to strikes or work stoppages, which can disrupt hospital operations and patient care. There can also be a power imbalance between management and unions, where one side holds more influence or resources, affecting the fairness of the outcome. In some cases, political interference in unions can shift focus away from genuine professional issues, weakening the bargaining process. Moreover, the agreements reached may not fully satisfy all members, as different nurses may have different priorities or expectations. Finally, there is a risk of conflict between professional ethics and union demands. For instance, nurses may feel torn between participating in a strike and fulfilling their ethical duty to care for patients. These challenges highlight the need for open communication, fairness, and professionalism in every stage of the collective bargaining process. Role of nurse managers in collective bargaining. Nurse managers play a crucial role in maintaining balance between organizational goals and the needs of nursing staff during the collective bargaining process. They must maintain open communication with staff, creating an environment where nurses feel comfortable expressing their concerns and suggestions. By listening to grievances and addressing them early, nurse managers can prevent small issues from growing into major disputes. They should cooperate with unions and employee representatives while always keeping patient care and safety as the top priority. During negotiations, nurse managers are expected to apply principles of fairness and justice, ensuring that every nurse is treated with respect and equality. Additionally, they must ensure that collective bargaining agreements align with healthcare standards, legal policies, and professional ethics, so that both staff welfare and quality patient care are maintained. In essence, the nurse manager acts as a bridge between management and staff, promoting understanding, collaboration, and harmony in the workplace. Collective bargaining in nursing is an essential process that helps balance the needs of nurses with the goals of the healthcare institution. When carried out in a spirit of good faith, cooperation, and mutual respect, it leads to better working conditions, fair compensation, and improved morale among nurses. As a result, staff become more motivated and committed to their roles, which ultimately enhances the quality of patient care. Moreover, effective collective bargaining helps reduce workplace conflicts and disputes, fostering a positive, stable, and professional healthcare environment where both nurses and management can thrive together. That brings us to the end of today's session on collective bargaining. I hope you found this video informative and helpful. Thank you so much for watching, and don't forget to like, comment, share, and subscribe for more nursing and health-related content. See you in the next video.